What is candidiasis? Treatment, symptoms and causes. Interesting about science and medicine prepared by the Sova page, all scientific. Mycosis or fungal infection is most often found in medicine under the name candidiasis. Usually, candidiasis appear in the moist part of the body where favorable conditions exist for microscopic fungi, between the toes and fingers, in the nail area, in the genital area, in the fold of the skin. Oral candidiasis is a painless infection in many cases with relapse, appearing in the mouth or throat. Often appears in newborn, in small children and in the elderly, but in some conditions it can appear in anyone, regardless of age. Thrush. Genital candidiasis is a painless fungal disease that occurs in many women, especially in such cases during pregnancy, during antibiotic treatment, antibiotic therapy. Balanitis is a rare infection of a male genital area but with very irritating consequences. Systemic fungal infection can occur in the following situations: with diabetes, with AIDS, during treatment with various drugs with suppressive properties on the immune system. Symptoms of mycosis. Candida albicans is a fungal microorganism due to which fungal disease can appear. Symptoms of mycosis are peeling skin on the hands, especially between the fingers, swelling of a nail fold in the cuticle area, pain, redness, suppuration. Symptoms of oral candidiasis. White painless formation in the mouth or throat, which can separate during meals or when brushing teeth. This disease is most often found in newborns, in the elderly, in the patient with AIDS. Symptoms of esophageal candidiasis. White formation in the mouth and throat, which in some cases are accompanied by pain when swallowing. Esophageal candidiasis can appear as a complication of AIDS. Signs of diaper rash and vertigo are a pink rash with scaly edge or with the appearance of blisters, itching, burning in the folds of the skin. Signs of genital candidiasis thrush in women: itching and inflammation in the genital area, redness and suppuration of a female genital area, weak white discharge and pain during intercourse. Symptoms of balanitis: red spot and blister on the male genital area, itching, sharp pain. When to see a doctor for candidiasis? If you are experiencing the above symptoms for the first time, if the infection does not respond to treatment or you experience a relapse, in this case the patient may have diabetes or AIDS. Causes of mycosis candidiasis. Candida albicans. Candida albicans is a fungal microorganism that can perfectly exist in such part of the body without causing discomfort to the body, in the mouth, in the digestive system on the skin. The fact is that the body has good bacterial flora which keeps the fungus with control. If the body's bacterial flora is damaged or the rate of development of Candida albicans is very rapid, fungal disease may appear. Causes mycosis candidiasis. Disease, stress, and antibiotics. The cause of fungal infection mycosis are diseases that weaken the body, stress, antibiotics during treatment with which most of the beneficial bacteria die. Diabetics are most often at risk of developing mycosis because they have high level of sugar in the blood and urine, as well as low resistance to infection. Causes of mycosis candidiasis: constant contact with water. Most often, mycosis occur in people who are constantly in contact with water. Dishwashing, children who constantly put their fingers in the mouth, people whose clothes retain body moisture. Mycosis are most common in people who are constantly in contact with water. Diaper rash in newborn, also known as candidal dermatitis, occur due to the rapid proliferation of microscopic fungi in the folds of a newborn skin. Causes of mycosis candidiasis: bad medical practice. In the medical practice, there are also no cases of infection with the Candida fungus through an intravenous catheter or during catheterization, probing of a bladder. If a fungal infection migrates to the kidney, lung, brain, or other organs, it can lead to systemic complication, but as a rule, such complication can only appear in seriously ill people or in patients with very serious problem with the immune system, with diabetes, with drug addiction. Diagnosis of oral candidiasis. To diagnose such type of mycosis as oral candidiasis, the doctor will analyze the patient's white formation and take a sample for analysis. Diagnosis of thrush. If thrush genital candidiasis is suspected, the doctor will analyze a fresh sample of genital area smear. Diagnosis of systemic candidiasis. In order to detect systemic candidiasis, the doctor will analyze samples or blood, feces, or disease tissue. Treatment of mycosis. Treatment of mycosis depends on the patient's situation, but in any case, its goal is to stop the reproduction of a microscopic fungus responsible for the infection. Treatment of oral candidiasis. The following antifungal drugs can be used to treat oral candidiasis: clotrimazole, ketoconazole. For newborn, nystatin is used for oral candidiasis, which is administered with a pipette. Treatment of skin and nail candidiasis. Skin and nail candidiasis is treated with local application of clotrimazole. Treatment of thrush. For thrush, an intravaginal cream containing clotrimazole or miconazole is used. Treatment of complication of candidiasis. All the above drugs are available without a prescription in many countries. If this medication do not help you, you can consult a doctor and he may prescribe a cream containing terconazole or an oral antifungal drug based on fluconazole. If a doctor has diagnosed the patient with systemic candidiasis, may prescribe injection of amphotericin or fluchitosine. Alternative medicine for mycosis. Copes with fluid task. Strengthen the immune system so that the body can more easily resist mycosis, cure various types of candidiasis, prevent relapses. Tea-free oil for candida. To treat skin candidiasis, you can locally use undiluted tea-free oil 2-3 times a day. When using this folk remedy, a slight burning sensation is normal, but if the treatment becomes painful, it's recommended to stop it. Calendula. Balm is used for skin candidiasis in children over 2 years old. Prevention of mycosis when working with water. If you must work with your hands in water a lot, wear rubber gloves. After you finish working in water, wash your hands and use a mild antifungal cream which is available over the counter. Wear only cotton or silk underwater wear, which compared to nylon and other synthetic materials allow body moisture to evaporate. Wash and dry your underwear well. Change it as often as possible. Chronic candidiasis. Although the term is not widely accepted, some doctors recognize the resistance of chronic candidiasis, which can affect the following system: immune system, endocrine system, nervous system, digestive system. What factors influence the development of candidiasis? Predisposition, medication, food rich in yeast and refined sugar, vegetable rich in carbohydrates, dairy products. The doctor may also prescribe tests to rule out various diseases: diabetes, thyroid disease. A good remedy for combating chronic candidiasis is tea made from 1-2 grams of dried berberry root or golden seal. This tea should be taken 3 times a day. With the permission of a doctor, daily supplements of iron, zinc and selenium should be taken. Avoid large doses of selenium. Thank you for your attention. This material was prepared by Page All Scientific. Attention, this material is for information purposes only. When observing various unusual symptoms, recommend to consult a doctor. Subscribe to our channel. Thank you. Bye bye.